All right. Hi, everybody. Thank you so much for waiting, and thank you so very much for joining. We have two portions to our meeting tonight, and the first portion is not political. It is an educational event only. We have a very special guest speaker that I'll be introducing in a moment. And then the second part of our meeting after our speaker presentation will be our regular monthly Democratic Committee of Lower Merion and Narberth meeting. So here we go. You may have heard that affordability is out of reach for many. You may be feeling it yourselves, and that is why we have invited, and we are so thrilled to be having the Secretary of Human Services, Dr. Val Arkoosh, joining us tonight. And Dr. Arkoosh is going to be talking about two of the biggest ticket items that Pennsylvania families are facing, the cost of healthcare and the cost of housing. In particular, the Secretary is going to be talking about the changes to healthcare and healthcare costs in Pennsylvania, particularly since the passage of H.R. 1, aka the Big Beautiful Bill, as well, and that also has affected food stamps or SNAP benefits. So we'll hear about that. And secondly, we'll be hearing about the governor's housing action plan, which is the plan to make housing more affordable for Pennsylvania families. And that is a plan that the secretary had a very big hand in developing. And then after that, if we have time, and you have time in particular, Secretary, we'll have a little bit of Q&A before we begin our regular meeting. So without further ado, I'm going to kick things over to the Secretary. Thank you so much for joining us.
Great. Well, thank you, Sean, and thank you, everybody. Good to see a bunch of friends on this call, and great to have an opportunity to share some updates with all of you. So this evening, we're going to very quickly and kind of high level, but hopefully I can answer some questions if there are questions at the end. Talk about some of the changes to SNAP and Medicaid, as you just heard, really how you all can help. It's going to be an extremely critical year as we look at particularly changes that are going to be coming in January. And then some updates on the governor's housing action plan, and then some questions and answers. So I know some of these slides are a little bit busy because that is the extent of what's happening these days. So we're going to start with a little bit of history. So this bill, I'm going to call it HR 1, was signed into law back in July the 4th by President Trump in 2025. And that started a number of things moving. The first of our programs to be impacted was SNAP, and that began in September 1st of 2025. We had a number of waivers here in the Commonwealth that allowed people who lived in certain parts of the state to not be required to meet SNAP work requirements. But HR 1 just ended them all as of September 1st, very abruptly. So we had only from the beginning of July to September 1st to even notify people. And then there were additional limitations put on SNAP that began in October of 2025. It limited, in particular, heating and shelter utility allowances, which had the impact of reducing the SNAP benefits for a number of people. That impacted 72,000 households here in Pennsylvania. Then on November the 1st of 2025, there was this expansion of SNAP work requirements. So unlike the Medicaid program, which you're going to hear about shortly, the SNAP program has always, or for many, many, many years, had a requirement that what used to be called able-bodied adults had to meet certain work requirements. What HR 1 did was expand the number of people who now must meet work requirements, and that started back in November of 2025. So now, if you are between the ages of 18 and 64, which was an increase from 54, if you are a parent of a dependent child 14 or younger, used to be 18 or younger, and if you're considered physically and mentally able to work, then you needed to start meeting a requirement of either 80 hours of work per month 80 hours of volunteering per month or some combination of those two, or you could be in a authorized job training program or in school at least part-time. HR 1 also ended long-standing exemptions for veterans from these work requirements and current and former foster youth between the ages of 18 and 24 who had previously been exempt from these requirements are no longer exempt. So our assumption, or I should say to date, so far, we've seen about 112,000 additional SNAP recipients out of just under 2 million here in Pennsylvania that were covered under these expanded requirements. So that's in addition to the group that was already having to meet work requirements. And then there's been a number of changes in eligibility for non-citizens. And again, these are individuals who are here with legal status. So people with certain temporary protected status, certain people who are here under asylum programs, things like that, people that were here with legal status. HR 1 has been slowly but surely reducing the ability of those individuals to have access to these programs. And so far, we've had about 20,000 individuals here in Pennsylvania with legal status no longer able to be eligible for SNAP. So, folks who were not meeting these new eligibility requirements began losing benefits in January of 2026. So that's kind of where we're at. To date in the SNAP program, we are estimating approximately 98,000 people or so have lost access to their SNAP benefits because of these new work requirements. And I do want to underscore that it doesn't necessarily mean that they aren't actually meeting the work requirements, but they have to also be able to report them to us. And we have done many, many, many things to make it as easy as possible to report that people are working, but it's not a perfect process. And many people don't have a lot of either access to technology or facility with using technology. And so, we continue to do everything we can to make it easy for people to report. But we know that almost with certainty, at least based on what's happened in other states, some of the folks that have lost eligibility for SNAP are actually meeting the requirements. And so this is, one of those areas where folks in the community, like all of yourselves, can help connect people and make sure technology is available and just help people sometimes navigate a website, right? Can be real challenging for people that didn't grow up or have a lot of access to those kinds of opportunities. So that is SNAP. What's coming next is Medicaid. So Medicaid has never had any type of work requirement in the program. So this is brand new since 1965 when Medicaid was begun. This will be the first time beginning in January of 2027 that certain individuals have to meet work requirements. What we're seeing coming to Medicaid first is on October the 1st, there will be non-citizen eligibility changes. So again, people here with legal status have formerly been eligible for Medicaid. Certain categories of those individuals will no longer be eligible for Medicaid and CHIP beginning October the 1st. And then January 1st are the major changes. Now, what's important to know about this is entirely for people or applies to people who qualify for Medicaid through the Medicaid expansion. So the traditional Medicaid population is not going to be impacted. But anybody who qualifies for Pennsylvania's Medicaid program because of the Affordable Care Act expansion of Medicaid, here in Pennsylvania, that happened under Governor Wolf in 2015. And that opened up eligibility for a number of people. We currently have over 800,000 people that qualify for Medicaid because of the Medicaid expansion. So everything that I'm going to say next applies just to that group of about 800,000. So first of all, everybody in that group will have to renew or what the word we use is redetermine, but they have to go through that eligibility redetermination every 6 months. Every 6 months. So imagine you had to file your taxes every 6 months. That's basically what we're asking these folks to do. Right now, today, it's every 12 months. So not only is it just an enormous burden on these individuals, but it's a significant increase in work for our staff. We currently have just under 3 million people in Pennsylvania's Medicaid program. And so about 800,000 of them are going to be in this new cycle where every 6 months we have to hear from them in some way. So the work requirements will impact adults between the ages of 19 and 64 who are not parents or caretakers of a child under 14 or an individual with a disability. If they are not pregnant or postpartum, they are not currently or formerly in foster care. They are not Native American, Indian, or urban Indian. They are not a veteran with a VA determined total disability, has to be total disability. They are not in treatment for alcohol or substance use disorder, and they are not considered medically frail. So the rules vary slightly between SNAP and Medicaid because that's just how they did it. You know, the SNAP program lives under the U.S. Department of Agriculture, and Medicaid lives under Health and Human Services. And so, unfortunately, while these rules are similar, they are not identical. But in general, both groups have to work at least 80 hours a week, be in school part-time or at least half-time, volunteer or do community service or participate in a job training program. And of course, very importantly, they can complete these requirements by a combination of those four activities. And this is something that we've really been trying to lift up, particularly to nonprofit entities. We all know that a lot of people with hourly jobs may not be able to get a total of 80 hours in a month. Maybe some months they only get 60 or 70, and it's really not going to be under their control. If they are working at a traditional work, let's say 65 or 70 hours a month, they could make up that additional 10 to 15 hours with volunteer hours to get them to 80. And that ability to do volunteer shifts could mean the difference between somebody being able to keep their Medicaid or SNAP or losing access to those benefits. So, for any of you who are in a position to offer volunteer shifts, that could be enormously helpful right now. It does need to be an entity that's a 501c3, and there has to be a willingness to fill out. Right now, it's a piece of paper. Don't yell. We're working to get it not be a piece of paper. It's a short piece of paper, but right now it's a piece of paper that then has to be uploaded to us, and that can happen by the participant, the person that's doing the volunteering. And we are working as quickly as possible to get off that piece of paper. Individuals can also be exempt from work and community engagement based on their income. And so if they're making at least $580 per month, then that can also exempt them, even if they're doing that by working less than 80 hours a week. So this is one of these nuances in this program that someone needs to really check in with our county assistance office who can work with an individual to verify that. So there is that one little nuance to the 80 hours. All right. So some of the ways that you can help is by sharing these resources. And so on this page are a number of websites that we have put up for the public to use. And we really, really hope that you will use them. So the first one is at our site that's at dhs.pa.gov/federal cuts. And that is like a one-stop shop for all of these changes. Then, specifically for the Medicaid work requirements and 6-month renewal information, you can go to that same home URL, dhs.pa.gov/Medicaid changes. And then if you go to dhs.pa.gov/work that gets you the SNAP work requirements. We put that one up first because the SNAP piece was happening way before the Medicaid piece. So that one's actually been up for a while. Another site that isn't listed up here that could also be helpful to you is dhs.pa.gov/data, DATA. And that can be helpful because on that site, you can see a lot of information about these programs. We also have participants sorted by county, by congressional district, by state Senate district, and by state House district. And then it gives some demographic information about who is in these programs. So that can be very helpful if, for instance, you're going to meet with a legislator. You can actually look up and see how many of these individuals are in a particular congressional district or state Senate or state House district. So that again, that's dhs.pa.gov/data. And again, all public facing, all available to anyone who's interested. Now, going back to those volunteer opportunities, which, as I mentioned, are extremely important. I don't know if all of you are familiar with PA Navigate, but if you're not, this is a great time to get familiar with it. So PA Navigate is our closed loop referral system. It's built actually for hospitals and doctors' offices and nurse practitioner offices to pull up within someone's medical record. And if they find out that somebody is food or housing insecure, for instance, they can go to PA Navigate and help refer them to services that are available in their zip codes. So it's pa-navigate.org. And when you go to PA Navigate, the first thing that will come up is a screen asking you to put in your zip code. So anybody can use this. While it was sort of built for providers, it's very public facing too, and people use it every day of the week. So the very first screen, which is not this one, the very first screen would just ask the person, the member of the public, to put in their zip code. So you can all try this. It's actually pretty fun to check out. And then when you put in your zip code, you'll go to a landing page for your zip code. And you can see right now, you can just see the food and the housing icons, but there's a whole bunch of icons across that landing page. It's like transportation, clothing, all sorts of things. And then there's a search box. And if you type the word volunteer into the search box and hit the little search icon, you will get nonprofits that have raised their hand with volunteer opportunities in your zip code. So this is one of the ways that we're making it easy for the public to find these volunteer opportunities. And again, these are 501c3s who've raised their hand and said, we have actual volunteer shifts and we'll help with the paperwork and all those pieces. So if any of you have shifts to offer and you are not already signed up, you can sign up at that website, www.panavigatehelp.org. And you can list your organization and any volunteer opportunities that you might have. Okay. So hopefully this will be helpful to all of you, either to help somebody search for opportunities, or some of you might be willing to stand up some volunteer opportunities. All right. So very shortly, as we get to the end of August and the beginning of September, Medicaid recipients are going to start to get information from us. So I'm just going to share this with you in case any of you get questions as people start to get outreach or you get outreach yourself. So as I mentioned, end of August, beginning of September, people will start to hear from us. And again, this is just the folks that are in Medicaid expansion. So it is that population of a little over 800,000 or so. People will receive 4 mailings, and clients who have shared their phone numbers with us will also get texts and robocalls. So if you get mail from us, please open it. That is like one of the most important things that people need to do right now. If they get mail from the Pennsylvania Department of Human Services, please, please, please open their mail. And then for folks in, as we get closer to 2027, if there are newly eligible Medicaid recipients, they will start to get outreach from us as well. So then January 1st will start. And officially, that is when we will need to start at first renewal, verify implementation of these work requirements or verify that people are meeting these work requirements. So they can show them by, as we mentioned, working, volunteering, or training. They must show that they've met that requirement for at least 1 month since their last renewal. So for somebody who's going to be renewing in early 2027, we'll be looking back 1 month. If somebody's applying for Medicaid for the first time ever in January of 2027, we can look back 6 months. And then that every 6 month renewal will start after their existing 12-month renewal date is processed. So people are going to be moving to every 6 months at different times throughout the year. So it is going to make it a little bit confusing for folks, but we're trying to give anybody that we can one more 12-month renewal. And so we're doing the 6 month, starting the 6 month renewals as late as we possibly can. So the timing, the dates are a little complicated. You all don't really need to worry about that. The most important thing is that people are aware of these requirements and that they have to report them. So just to kind of walk through some little bit more specifics, if you're somebody new applying for Medicaid in January of 2027, in addition to all the normal things like income eligibility and things like that, if you qualify because you're in that Medicaid expansion population, then we would be looking for you to have met that work requirement in the month prior to you applying. So in this case, in December of 2026. And if you're eligible for Medicaid and you come in as a brand new Medicaid recipient in January, then you'll have to renew again in July of 2027, redetermine that eligibility. So if you're that person in June, you're going to receive a packet from us that says, hey, next month you have to reapply again. And then you'll have to go through that, redetermining that eligibility in July. And during that renewal, we're going to look that you have met the work requirement for at least 1 month since you applied. So anytime between January and July, you'll have to have met that work requirement. And then for folks that are renewing, so people that are already in our Medicaid program, it's going to look a little bit different. That outreach has to start right now or at the end of this month. It's going to be a little confusing for folks because there's some people that we know will be able to give exemptions to, but we are required by the Medicaid program to send notice to everybody this fall. So for folks who are already in our program, they will keep their existing 12-month renewal date in 2027. And their 6 month renewal won't start until after the first renewal that has been processed in 2027. So, in other words, if a client is renewed in 2026, September of 2026, that's just their normal renewal date, is this September. They won't have to renew again until September of 2027. Okay, so hopefully that makes sense. But then they'll have to renew every 6 months. So that's how this is going to roll out in Pennsylvania. And again, we've taken every flexibility that we can to give everybody we can a 12-month renewal into 2027 and then start their every 6 month. I only mention that because there are states that are saying, okay, as of January 2027, everybody's on a 6 month renewal. So if you hear that, we did not do that here in Pennsylvania. That was a flexibility that we had as a state. And so we took the longest possible runway here so that folks could begin to understand what is required of them and have some time to prepare and work to meet these, do whatever they need to do to meet these work requirements. All right. So another way that you can help is that we have created a Substack. It's called the Human Services Helpers Substack. And we are sending out communications pretty much every week. And what are you holding up there, Sean? Do you actually have a...
I'm taking a picture of your slides.
Oh,
so
perfect. Good. Take pictures.
ready.
So every week through this Substack, we send just about every week, we are sending out actionable advice. So free social media graphics, language that you can use to help share information. And we will be releasing a Medicaid toolkit, again, with public facing information, graphics, all of that. And that's coming soon. So if you want to sign up for our Substack, we would be really, really grateful. They're short, actionable messages, and they do go beyond the SNAP and Medicaid programs. For instance, when we had all of our sign up dates for the LIHEAP program, which is the low income heating program, like that went out through our Substack. So if you're interested in just being a messenger for the communities that you're in, this is a great way to get very timely and very actionable information. And for those of you who aren't wild about QR codes, you can sign up at pennsylvaniadhs.substack.com. So that's the URL, pennsylvaniadhs.substack.com. Okay. Why don't I stop, Sean, for just a minute before we switch, entirely switch gears here? I know that was a ton of information, and I'm happy to do my best to answer questions. Carly.
Hi, thank you so much for being here. So, I advocate with and for people who live with myalgic encephalomyelitis, chronic fatigue syndrome, long COVID, other infection associated chronic conditions and illnesses. And what we're working to do is get certain conditions and diagnostic codes added to the medical frailty list. So, we're hoping for self attestation and self declaration, but we're working as state by state and as throughout the country to make
Mhm.
sure some of these invisible illnesses and also illnesses that aren't easily diagnosable, because at least with ME/CFS, we don't have easy biomarkers and not everyone has access to healthcare to get a diagnosis. So we're
Right.
working really hard because we know thousands and thousands and thousands of people are going to lose their Medicaid. Can you help me understand the process? We've been doing a lot of advocacy work, but is there
Yeah,
something that I can follow up on either with you or somebody else?
absolutely.
Yeah,
So
so
we have a hundreds of pages of codes that we are starting from for our medical frailty identification. And we've got a pretty robust process that we're putting in place to exempt anyone who meets a pretty broad set of criteria. We have to do it obviously under CMS guidance, but we have some
mhm, mhm, mhm.
flexibility. If you would like, if you could, do you have a list of codes of,
Yeah, I do. I
could you
have
do me a
like,
favor? Could you get them to Sean and Sean can get them to me?
sure,
And we
absolutely.
can take a look and see if they are already in our list. And if
Okay,
not, I
wonderful.
have a whole medical team that's been evaluating codes, and I will hand those codes off to them and they will take a look.
Great.
Okay.
Is there someone I can follow up with? Maybe someone, Sean or
Yeah,
someone
I
can
will.
help
If
me.
you just get Sean your stuff, I'll make sure we get follow up. Yeah, we'll
Okay,
get you some
wonderful.
emails and stuff.
Okay,
And
great.
then
Thanks so
you
much.
did bring up something very important. So during 2027, CMS is going to allow self-attestation. So in other words, if we miss somebody through our process, or someone believes that they have a condition that they can self-attest that they're not able to work, so will caregivers. Caregivers of older adults will also be able to self-attest during 2027 that they are doing that work. However, in 2028, self-attestation will no longer be allowed. But we've got a year to build a process to capture all the self-attestation situations. Right now, we are laser focused on January 1st and creating the most robust definition of medical frailty that we can, so that we can exempt as many people as possible just automatically based on data that we have in our Medicaid program through either medical claims or encounter data, it's called.
Mhm,
So
mhm,
we're
mhm.
doing all of that on the back end. So if you just for now get me your codes and then we'll see if
Yep.
they're already in there. And then we're also working on that self-attestation process to make it, again, as easy as possible for people, knowing that we're going to have to effectively eliminate it in 2028. But we've got some runway to get us to 2028. And we are very much viewing this as a continuous learning process. We're
Mhm.
building our system. I have a really strong data analytics team, so we're building this system ourselves. So we will be able to adjust it as we go, unlike a lot of other states. So
Okay.
we'll welcome that
Wonderful.
interaction. Yeah. So thank you for
Wonderful.
raising that. Yeah.
Thank you.
Yeah. Sean.
Thanks. What would you say? Some people might hear this and say, um, what's the big deal? Just do the paperwork, right? Or like, what, if you're able-bodied, and why don't you just get insurance through your job? Um, why is, can you explain that?
Oh, yeah, sure.
Talk about that?
Absolutely.
Thanks.
So, first of all, many people, particularly hourly workers, do not have access to insurance through their employer. That's just a simple fact. And so, for individuals like that, they really do rely on Medicaid. They make an income at their hourly job that they qualify for Medicaid. So, they are already low income pretty much by definition. In the Medicaid program, even with the Medicaid expansion, in the vast majority of cases, you can't make more than 138% of the federal poverty level. Now, there is some differences for individuals with disabilities and other situations, but they're not really in the expansion population. They're in the traditional Medicaid population for the most part. So we're talking about a group of individuals who are already low income and don't have a great deal of control in many cases over the hours that are eligible for them to work. And most of those jobs do not come with health insurance. So it is really going to be important that we create as many opportunities as we can for these people to meet requirements. The other, very concerning situation is that if somebody loses that job, um, then they're really stuck, right? And will be needing to work quickly to try to find some kind of replacement position. There's nothing in this law as written that accounts for unemployment. So if a county or a municipality or even a state were to experience significantly high unemployment rates for whatever reason, there is still a provision in SNAP that can account for an unemployment rate over 10%. There's nothing like that in Medicaid. So people could really find themselves in a quite difficult situation. I think the other thing, and I get asked this question a lot by individuals who are fortunate enough to have private health insurance through an employer. I've been asked many times, well, why does this matter to me? Because I don't get Medicaid. And I think it's really important for folks to understand how interconnected our healthcare ecosystem is. And what I mean by that is if people arrive at an emergency room because they're having a heart attack or they've been in a car accident or any other emergency, whether they are insured or not, hospitals take care of them. Did that, many of you know I practiced medicine in Philly teaching hospitals for 20 years. We took care of uninsured individuals every day of the week. And if what happens then on the hospital side is if that person's unable to pay, they get put on a payment plan, but it's usually just a very small amount of money a month and could literally be for like years of their life that they'd be trying to pay that cost off. The hospitals shift the costs of that uncompensated care onto the people that do have health insurance. And so what that means is the price of health insurance for everyone that does have it goes up as a result of that hospital seeing uninsured patients. And so we are all connected in this situation, no matter where you get your health insurance. It is truly a community that is being impacted by this. And it's not my agency, but I will share with you that I'm sure some of you maybe have been impacted by this, that under HR1, one of the things that changed was there were subsidies that the Biden administration had added to Affordable Care Act plans. Here in Pennsylvania, that's called Penny, that made those plans much more affordable. And in fact, we had the highest enrollment in Penny last year. It was up to 500,000 people. And these are commercial insurance plans that were subsidized through Penny, Pennsylvania's health insurance exchange. Those subsidies were stopped, and we now have, in 2026, we're up to about 165,000 people who could not afford to renew their Penny plan, and many of those individuals are now uninsured. They make too much money to qualify for Medicaid, so they can't get Medicaid, and they can't afford Penny, and they don't have insurance through their job. And so these people are really stuck. And I'm starting to hear from our hospitals that they are seeing, not surprisingly, increasing numbers of people show up who are uninsured. And that's before these Medicaid cuts have even gone into effect. So our hospitals, many of whom, particularly in our rural communities, are hanging on by a thread. Many of those hospitals are operating with no profit margin or even slightly negative profit margins. And of course, I know some of you probably are from Delco and experienced the closure of Crozier. Sadly, every prediction model shows that because of HR1, we are going to see more hospitals close in Pennsylvania, which is just a devastating outcome. And the cost of health insurance is going to go up for everyone else. Commissioner Humphreys, who's our insurance commissioner, shared the other day, and you should be able to find this press release. His office, the Pennsylvania Insurance Department, reviews all requests for insurance increases in those penny plans that I was just mentioning. And they just got the requests in. They were due a few weeks ago. And I think the average increase, the average is close to 18%. And on the high end, there was a plan that asked for a 40% premium increase. Like this is what we're seeing out there. So no matter where you get your health insurance, these changes from HR1 are going to impact you either potentially directly or indirectly. I wish I had better news. But I think that's why it's so important to have these fact-based conversations so that you can understand some of these very direct impacts on people across the Commonwealth.
I don't know how to raise my hand on this Zoom thing. My name is Bill Mahler. May I ask a brief question?
Hey, Bill. Yeah, go right ahead.
Um, what was the expectation from these onerous requirements for a SNAP? Was it presumably to drive more people into the workforce, perhaps to replace all the migrants that are being deported? And not to mention the cost of health or um, uh, child care that most people can't really afford. Are they expected to achieve their goals?
So, Bill, you were breaking up a little bit, but I think the gist of your question is why did they put these stringent work requirements on and expand them and like what was
Yeah,
their goal? Is that what you're
expecting
asking?
are they expecting people to be driven now into the workforce?
Well, I believe that some people would say that that is what they're hoping for, is that they're hoping by more stringent work requirements that um, there is a perception among some that there are individuals who could be working that are currently not working. Our data suggests that that is a very low number. Generally, we have information as to whether or not someone is working because we have to get that information to determine whether or not they qualify for any of these programs. So we do have a sense that um, certainly in Medicaid, I have those numbers at the top of my head. Nearly half of the Medicaid recipients in the expansion population are already working. But in the SNAP population, I don't remember off the top of my head what that number is, but I do think that there was some hope that people would work who could, who were able, but they also have to be able to find a job, right? So it's not as simple as just go out and find a job. But also, Bill, the Congressional Budget Office, which they call it scored this bill, uh, accounted that there would be about $1 trillion of savings from people being disconnected from benefits through all of these programs. And that money is being used to fund tax cuts. That was how HR 1 was put together, was to take money from these programs and use it to offset tax cuts for individuals who qualified for tax cuts under HR 1. So the CBO, the Congressional Budget Office score shows that they anticipate millions of people being separated from these benefits.
Thank you.
Okay, so people can think about other questions. We can also always come back, but I'm going to move on to the Housing Action Plan. So back in March of 2024, the governor signed an executive order. You could see me standing in the back there over the governor's shoulder. I'm sorry, it was not March. That's the executive order number, 2024-03. The governor signed it in September of 2024. And this executive order was to create a housing action plan. The goals were several: to address our housing shortage across the Commonwealth, to reduce homelessness, and expand housing options that are affordable for working Pennsylvanians. So we undertook a tour of the state, and it was myself and the secretary for the Department of Community and Economic Development, and the governor's policy secretary and budget secretary, the whole group of us. And we held 15 or 16 roundtables all across the state, just meeting with folks involved in building housing, connecting unhoused people to housing, kind of the whole gamut of folks who are involved in housing. And our plan has several primary areas of focus. One is to build and preserve Pennsylvania's housing stock. You know, the most affordable house is the house that you're already in. And if that house just needs some fixer-upper kinds of things, you know, maybe you need a roof repair, maybe you need some help getting your HVAC replaced, those sorts of things, that is always going to be less expensive than moving to a new house. And a lot of our housing stock here in the Commonwealth is very, very old. Not everyone knows on this call, we're an old state. And so we have a lot of very old housing stock. And so, you know, one of the number one goals is to preserve what we have. We want to expand housing opportunity for all Pennsylvanians. We want to provide pathways to housing stabilization and sustainability. And, you know, and that the way to think about that is once somebody is housed, we want to make sure they're able to stay housed. We want to modernize Pennsylvania's housing development regulations. There are regulations that are unique municipality by municipality. And if there was a way to help standardize that just a bit and modernize it, that will go a long way to helping. And then we want to make sure that we have operational excellence across all the work that we do at the state level. So it was kind of an all of the above approach to housing. So, let me go back. I thought there was another couple slides there on that. Let's see. Oh yeah, okay. So let me go back and tell you a little bit more about the plan. So it looks like there is not a link to this plan. I apologize for that. I might be able to quickly get one, or I can get it to Sean, so all of you can take a look at the plan. So there's a number of things that are in the plan around each of those priority areas. One of the things that I am particularly excited about that was a real win in the governor's budget for the state 26-27 state budget year is that our investments in health for housing was funded this year. And that will allow us here at DHS to use Medicaid dollars to fund a housing pilot. And so we are getting about a $900,000 investment of state dollars. We'll be able to match that with additional federal dollars for a little over $2 million that we will be able to put towards housing unhoused individuals here in the Commonwealth. Through using those Medicaid dollars, we're going to be focusing on individuals who are currently unhoused, who have a serious medical condition, or are pregnant or postpartum, who have used or visited a hospital emergency room once or twice in the last 6 months or been hospitalized. And again, these are folks that literally have nowhere else to go. So they do end up becoming oftentimes high utilizers of hospital emergency departments. And the goal is to try to rapidly rehouse those individuals, get them some intensive case management, and wrap those services around them to provide them with some housing stability, get their medical condition treated. It is really hard to follow a treatment plan when you're unhoused, particularly if you need to take a medicine that needs to be refrigerated and you have no access to a refrigerator. And so, like, these are the very real practical problems that make it almost impossible for someone who's unhoused to achieve any degree of health if they have a serious chronic condition. So our goal will be to get them stably housed, get them in that treatment plan for their condition. The conditions will also include serious mental illness or substance use disorder, get them stabilized, and then hopefully then help them get back on their feet, get back into the workplace. We have seen in other states that have done this really significant outcomes and savings in the Medicaid program. Ability to reduce hospital emergency room visits by 35%, and then, similarly reduced hospitalizations by 35%, and a pretty high degree of enabling people to actually get back on their feet and back in the workforce. So we're hoping to see some outcomes like that as well. We're working on kind of a one-stop shop website so that anybody with housing questions has one place to go. Right now, the housing work is spread across several different agencies here at the state level. So we're hoping to make that a whole heck of a lot easier to navigate for folks. And those are just some of the kind of early things that we're getting started with. But we were thrilled to get that piece for the Department of Human Services and the governor's budget passed this year. All right. I am happy to take more questions if you all thought
Thank
of
you
some.
so much, Secretary. I think we have time for one question if anybody has a brief one. And if you think of anything after that you wanted to ask, you can send me your question and I'll get it to the Secretary. Maybe we don't have anybody right now, but that's exciting that you're going to have the website up because the housing plan really is fantastic.
Yeah, and Sean, if you just shoot me an email, I'll make sure I'll get you the URL so that folks can take a look at the housing plan themselves. Yeah, it's
Wonderful.
really exciting work. We're very, very thrilled about it.
Yeah, thank you for all your work on it. And thank you so much for joining us tonight. This has been so interesting and informative, and you made us
Thank you.
smarter.
Good. I hope it helped.
Yeah,
Yep.
thank
Thank
you.
you all so much.
Have a great night.
Take care.
Bye-bye.